Have you ever heard about endometriosis? No? Well, you're not alone. Despite affecting approximately 10% of women worldwide, it remains a little-known condition. Endometriosis, a chronic disease that lurks in the shadows of women's health, has been on the radar for quite some time, yet continues to be overlooked. It's a condition that affects the reproductive system, making the lives of many women incredibly challenging. It's not just about the physical discomfort, but also the emotional toll it can take, impacting overall quality of life. The lack of awareness and understanding about this condition is stark, and it's our mission today to change that. We're here to shine a light on endometriosis, to dispel the myths and misconceptions, and to provide clear, accurate information. By doing so, we hope to foster understanding and empathy for those who live with this condition every day. Stick with us as we delve deeper into understanding what endometriosis is all about. So what exactly is endometriosis? It's not as complicated as it sounds. Endometriosis is a medical condition that occurs when tissue similar to the lining of the uterus, known as the endometrium, starts growing outside the uterus. This tissue can proliferate on the ovaries, fallopian tubes, and the interior of the pelvic area. While it's less common, it can also spread beyond these areas. Now, just like the endometrium thickens, breaks down, and bleeds with each menstrual cycle, so does this displaced tissue. However, unlike the endometrium, which leaves the body through menstrual bleeding, the displaced tissue has no way to exit. This can lead to cysts, also known as endometriomas, and scar tissue, or adhesions, which can cause organs and pelvic tissues to stick together. It's important to understand that endometriosis is not just about painful periods. The presence of this tissue outside the uterus can lead to severe pain and a multitude of other symptoms. Some individuals may experience intense pain, while others might have little to no pain. The severity of pain isn't always a reliable indicator of the extent of the condition. The symptoms of endometriosis can vary, but they often include pelvic pain and cramping, which can start before and extend several days into the menstrual period. It may also include lower back and abdominal pain, excessive bleeding during periods or even between periods, and digestive problems like diarrhea, constipation, or bloating, particularly during periods. Additionally, endometriosis can make it challenging to conceive. In fact, some women only discover they have endometriosis when they seek help for fertility issues. This is why awareness and understanding of this condition are so crucial. Endometriosis is a serious condition that affects an estimated 1 in 10 women of reproductive age. Despite its prevalence, it often goes undiagnosed due to the normalization of menstrual pain and the variety of symptoms it presents. Now that we know what endometriosis is, let's explore what causes it. The exact cause of endometriosis remains unknown, but there are several theories. Let's shed some light on these theories. First and foremost is the concept of retrograde menstruation. In simple terms, this theory suggests that during a woman's menstrual cycle, some of the menstrual tissue backs up through the fallopian tubes into the abdomen instead of leaving the body. Once there, it implants and grows. Another theory points towards disorders in the immune system as a possible cause. The immune system typically identifies and destroys any foreign or abnormal tissue. However, in cases of endometriosis, it's thought that a flaw in the immune system might prevent it from recognizing and wiping out the endometrial tissue growing outside the uterus, allowing its growth to go unchecked. The third theory we're going to discuss is genetics. Like many other medical conditions, endometriosis also seems to run in families. This suggests that there may be certain genetic mutations that make a woman more susceptible to developing the disorder. Now, it's important to note that these are just theories. The medical community is still working tirelessly to pin down the exact cause. It's likely that endometriosis results from a combination of several factors, rather than a single cause. For instance, a woman might have a genetic predisposition for endometriosis, but it might only develop if she also experiences retrograde menstruation. Understanding the causes of endometriosis is a complex puzzle that researchers around the globe are trying to solve. It's a piece-by-piece process, and each new discovery brings us one step closer to a clearer picture. Remember, the lack of a definitive cause does not make endometriosis any less real or serious. It's a condition that affects millions of women worldwide, causing significant distress and often leading to complications if left untreated. While the causes may be unclear, the symptoms of endometriosis are quite specific. Let's delve into those symptoms in the next scene. The symptoms of endometriosis can be debilitating, but they're not always the same for everyone. Endometriosis is a condition that presents itself in many ways, making it somewhat challenging to diagnose. Let's delve into the most common symptoms that may indicate the presence of this disorder. At the forefront are severe menstrual cramps. Unlike the typical discomfort that many women experience during their period, these cramps are often described as intensely painful. They might even worsen over time, and common over-the-counter pain medications may not provide sufficient relief. Next, we have heavy periods. Women with endometriosis frequently report menstrual bleeding that is significantly heavier than normal. This can often be accompanied by bleeding or spotting between periods, adding to the discomfort. Another common symptom is pain during or after intercourse. This isn't just a little discomfort we're talking about. It's a deep, penetrating pain that can persist long after sexual activity has ended. It's important to note this kind of pain is not normal, and if you're experiencing it, it's crucial to seek medical advice. There may also be pain during bowel movements or urination, especially during your period. This can be accompanied by other gastrointestinal issues like diarrhea, constipation, and nausea. Infertility is also a common symptom. Many women first discover they have endometriosis when they seek help for fertility problems. While endometriosis is among the leading causes of infertility, many women with the condition are still able to conceive. The severity of these symptoms doesn't always correlate with the extent of the condition. Some women with severe endometriosis may have minor symptoms, or even no symptoms at all, while others with a milder form of the disease might experience severe symptoms. This is one of the reasons why endometriosis can be difficult to diagnose. It's important to remember that experiencing these symptoms doesn't necessarily mean you have endometriosis, but they are signals that you should consult with a healthcare professional. Recognizing these symptoms is the first step towards finding relief. Endometriosis can be a difficult condition to manage, but there are several treatment options available. This condition, characterized by the growth of endometrial tissue outside the uterus, can lead to significant discomfort. However, the good news is that there are ways to find relief. Pain medication is often the first line of defense in managing endometriosis. Non-steroidal anti-inflammatory drugs, or NSAIDs, can help alleviate the pain associated with this condition. For some, over-the-counter options may be sufficient, but in more severe cases, prescription-strength pain relief may be necessary. Hormonal therapy is another common treatment approach for endometriosis. This can include hormonal contraceptives, gonadotropin-releasing hormone agonists and antagonists, and progestin therapy. These treatments work by reducing or stopping menstruation, which in turn can reduce the pain and stop the growth of endometrial tissue. In some cases, surgery may be recommended. This can range from minimally invasive procedures to more extensive operations like a hysterectomy. However, it's important to remember that surgery is typically considered a last resort after other treatments have been tried without success. But treatment for endometriosis isn't just about medication and surgery, it's also about lifestyle changes. Regular exercise, a balanced diet, and stress management can all play a role in managing symptoms. Yoga and mindfulness practices can also be beneficial, helping to manage stress and improve overall well-being. It's also worth highlighting the importance of individualized treatment plans. Everyone's experience with endometriosis is unique, and what works for one person may not work for another. That's why it's essential to work with a healthcare provider to develop a treatment plan that's tailored to your specific needs and symptoms. Endometriosis is a complex condition, but with the right knowledge and care, it can be managed effectively. Remember, you're not alone in this journey, and there are many resources and support networks available to help you navigate this condition. So let's recap what we've learned about endometriosis today. Endometriosis is a medical condition where tissue similar to the lining of the uterus, called the endometrium, grows outside the uterus. This can happen on the ovaries, fallopian tubes, and the tissue lining the pelvis. The potential causes of endometriosis are not fully understood, but they may include genetic factors, retrograde menstruation, and immune system disorders. Symptoms can vary greatly, but they often include painful periods, pain during intercourse, excessive bleeding, and infertility. Relief measures can range from lifestyle changes and pain management techniques to hormonal therapies and surgery. It's important to remember that endometriosis is a common condition affecting millions of women worldwide. It's not a condition that anyone should have to suffer alone or in silence. Remember, if you or someone you know is experiencing symptoms of endometriosis, seek medical advice. There is help available, and no one should have to suffer in silence.